from, how do you pronounce it?
Chirotecture.
Chirotecture across the street. I had plantar fasciitis and an ankle problem, and I went to Dr. Ramirez, and 6 weeks later I PR'd and I did. But what I did do is I stopped being injured, because not only did he show me exercises to do that I could do on my own, so it wasn't like I just went in and got worked on, but I also got the information I needed, and I found it to be a very, very big help. So he's going to talk to us today about
RockBalls.
About spiky balls of doom. So, Eric Ramirez.
All right, thank you. All right, so I put this class together because I know a lot of people are using like lacrosse balls, or maybe if you have the bigger one, like a spiky ball. And everybody's using them like a foam roller. Like you lay on it and then you just start rolling around on it. So you're going to get similar results to a foam roller. It's still good, so I'm not saying don't use a foam roller, but that's like one of these. So you can roll on it and it'll release out some fascial tissue. But if you roll on this, it's the same thing, it's just a smaller surface area. So it'll dig in a little bit more, but you're kind of doing the same thing. You're just breaking up a little bit of superficial, and it's not really getting in there and releasing it out. So if you know a little bit about the anatomy, you can use one of these to do a release. Still not as good as if someone was doing it to you, but it'll work pretty good in a pinch, and actually you'll probably get quite a bit of pain relief if you do it like that. So I'm just going to go over, I think we did 5 different spots, since I guess all y'all are runners. So mostly lower, I don't have to worry about upper, but if y'all have any questions at the end, just ask me. So I'll go through, I'll need someone to kind of come up so I can point out certain anatomy to whoever is not bashful.
Amy, you just ran.
Come off the table?
No,
Come on, David, you're dressed in a
yeah.
shorts and jeans. That would be fun.
All right, everybody out.
So I'm going to point out some of the anatomy that goes with the area that we're doing, and then I'll demonstrate some movements and I'll explain what we're doing. Keep in mind, like 2 things to remember on this is we're going to get on painful areas, so I'll show you where the muscles are that I'm talking about, but each individual will have different areas that hurt in that muscle, and you're going to want to focus there as where the ball's going to go. And then I'll talk about, well, the other thing to keep in mind is we're always going to be lengthening. We're starting short muscle, and then we're lengthening it out. So that's how we do the movement on it. So I guess, I don't know if I should save the worst one for last. Yeah, let's start with the easy one. So calf and soleus, if we want to release that out, foam rolling actually really works, like it works really well on this area. So if you just foam roll on it, it's fine. But everybody knows where the calf muscle is. So it goes right in through here. You have a medial head and a lateral head. So if I want to go in and release it, you can go and have a seat.
Sit down or?
Yeah, you can sit. I'll do this part. So which one will work pretty good with this is like the smaller ball, if you had one of those. If you only have one size, it works good. This one doesn't work that good in the hip, but I'll get to that in a second. So if we go here, I'll put this on my calf, and you can use a rolled up towel or just like a stretchy band like this. Get it on there. So like let's say that my pain's on the medial side. I'm going to take this leg over to get some weight on it, push down into it, and then all I'm doing is stretching my foot up. So what that's doing is calf is short right here, and then as I pull it this way, it's lengthening it out. So if you think about muscle being underneath the ball, and as I do that, it stretches through there. So it's like a flossing. So if you've ever heard of nerve flossing, this is our tendon flossing. This is similar to that. And most of the time, you're going to want to put it where the muscle hits the tendon. So if you flex the muscle, you'll be able to see like there's a spot where it stops, and the rest of that's all Achilles tendon. So you can put it right in there, and then as you stretch it out, it takes the tissue through there. But you want to get good pressure on it. So that's one of the things that is harder to do. If you can handle it, you can go here, get a lot more weight on it. That's the problem. Their shoes are too bulky. So go here, put some weight on it, and then point the toe, and then bring it up through there. You can't really see what I'm doing, so I'll have some people try it out. But as I go through there, I'm just going all the way across that muscle, and I'm bringing it up slowly. Question?
So is there an advantage to doing this if you've never had calf problems, or is this something that's more beneficial to someone who's got really tight calves or struggling?
Yeah, if you notice that the calves are tight, let me take these off for now. If you notice the calves are tight and you don't really have any pain on it, that's still a good indication that you're going to develop some problems in there. So that's where a foam roller is really good at. Foam roller is good for maintenance. So if you just roll that out, it should do good, especially the calf, because it's a small muscle group. So if you cross over like this and you put your weight up on it and you start rolling it, it's going to release it out. But if you have some like specific spots that you just feel some tightness, you know, you guys won't really know what fascial adhesions feel like, but as soon as you find them, you know. So like as I'm going through here, it feels really soft, almost like if I was cooking chicken and you just push on the chicken, it's soft, and then all of a sudden you get right there, there's a hard spot. So that's going to be some fascial adhesions, and so I'll just get it and I'll just bring it up. So the hardest part about this is you just have to know the anatomy, which is what I'll make a PowerPoint that you guys can access, and then you'll be able to see some of the anatomy that I'm talking about. And you just have to know short to long, and that's all it is. And then put pressure into it. If you don't feel, if it feels really easy to do this, and you just feel a little bit like the ball is just there, that's not hard enough. You want to be able to feel the tissue stretch through the ball.
How long do you do it?
Do it.
How long do you stretch?
I usually, so the same with the foam roller, I usually say like 10 to 15 passes through it, but you'll kind of feel it. It's like a sensation like melting butter. Like if you visualize like butter melting on a knife, that's what it feels like. Like it's just melting away kind of. It just gets really soft all of a sudden. And you'll kind of know, and when you get done, the muscle should feel kind of dead. Like if you just got done running, it'll just feel kind of dead. With, like when you get done running without the tightness. Any other questions?
David, do you still sell the spiky ball
Spiky
in a
balls?
smaller, but in a, because I have one for my foot that's smaller, bigger than a lacrosse ball, but smaller than that other
You
one.
can use it on your calf. Parts of like piriformis, it's not big enough, but for lower extremities, really hamstring and down, I've used it and it's good. But once I get above, up in
Right.
this area, it's just too.
Then
I
more,
can't get
right.
deep enough. You know.
Right.
This is bigger and
Right.
more.
Yeah, so these, I brought these, CrossFitters know this brand, like Rock, because Rock tape, and then they make like other stuff that I have with me too. It's because the price isn't that bad on it, and then you get the 2 different size balls, but
What is the price on it, Doctor?
$20.
That's not bad.
Yeah.
Do you sell that at your clinic?
I do sell it, but I don't really focus. Like I have it there because if someone needs it. But you know, this is a 3.5-inch ball. I think a softball is a 4-inch ball.
And ours are 2.5. The ones
2.5. That's this. Is your spiky?
Mine's spiky. It's
Yeah.
that, just a little smaller.
Yeah, it's this size but spiky.
Yeah.
Yeah, so this is like a lacrosse ball.
Right.
So this is what most people are already using. It's just they come together. This size here, that 3.5-inch, works really, really good for like what he said, piriformis and all that. That's what started this whole thought process in my head, because I always have problems with mine. And I used to just lay on my fist and stretch it out. So we'll get to that one. That's probably the last one because it's my favorite one. And it helps, it'll help a lot of y'all out with that. So that was the calf muscle. Let's go into the hamstring since we're here. So hamstring we're gonna do on a. You have to do it on a bench or
I got my tights on
table.
already.
So this one will probably be a little bit too big for most
You
of
need
y'all.
me for this?
No, I can do this one. So everybody knows hamstrings. If you have like, so right in here you have hamstring that comes into the medial side, and then you have lateral side. There's three different muscles in there. This is the majority of the hamstring is the muscle belly here. Where you usually pull hamstring is where that muscle belly hits tendon. And so it's going to be out here with me. I don't have very long hamstring tendon. But it's going to be out in this direction. But again, you'll know where you're having like the irritation at on the hamstring, and you just stick the ball in there. Sit on it. This is too padded, so you're going to want to sit like on a regular chair. And then you're going to put your pressure into it. So I'm lifting myself up and shifting my weight here, and then you're going to slowly extend that leg out. And if you're having trouble doing that, just get like a band or a towel like that and pull it. The only problem is you kind of have to use your hands to shift that weight. And then you're just going through there.
It really hurts.
Can you do it on the other side so we can?
Oh yeah, sorry. I was trying to switch because this calf muscle is all loose and will walk around funny. So yeah, put the pressure into it with my right leg, and then I'm taking it through there. And I'm being like really deliberate with my movements because I want to feel it stretch through there. And then go through there.
And it's about 15
Yeah.
times as well.
I'm just finding spots on that need to be worked on. So again, that one's really easy because everybody knows the hamstring, and then you're just bending your leg. Now we get to the hard ones. All right, quads I don't need to show. I won't need to show them again. So there's lower end of the quad. So a lot of like your patellar tendon. Oh, I guess that's what I could talk about. The actual injuries. So actually, there's no named injuries here. I mean, if you pull a hamstring or you strain a hamstring, that's what this is
It's
good
not
for
runner's
here.
hamstring.
Yeah. And then calf, same thing. Like if it gets tight or you start getting some issues in there. One of the main things I see with calves on runners is the two heads will start to get adhesion between the two, and it causes a lot of irritation. So I have to go through the middle of them and release it out. And you've had that done. How did that feel?
It was horrible. But I would like to add one thing, because I think it's important for us, is a lot of times we'll be out for a run, something will get tight, you'll know something's wrong, but you just kind of finish the run, you kind of get through it, and you got to pay attention. Those are the things that it might just be an irritant on Saturday, but 3 Saturdays later you're down for 12 weeks. A lot of that's avoidable. A lot of the soft tissue injuries are very avoidable if you pay just a little bit of attention. I mean, 15 passes, it takes 2.5 minutes, 2 minutes to get set up and ready. So I mean, definitely pay attention to those tightnesses, those little niggling injuries, the hamstring, if things get tight, because that's the stuff that 2 runs later you have to stop at mile 6, and then you're done. Once it gets hurt to that point, you can be out for a lot longer than just a day or 2. So
yeah, and earlier, like I'll get these into the clinic and diagnose it. The faster it is for me to release it out. The problem is most people are able to hold off because y'all deal with pain all the time. Y'all wake up the next day and blisters and feet hurt and everything's sore.
No.
No? All right. Well, I had blisters.
Well, these work on blisters.
No. Yeah, I'm not working on blisters. I'm saying you're used to pain because you're having to
there's
deal with
an
all those
inside
things.
joke.
Oh, okay. Yeah, so I mean, you're used to pain, so you can kind of put some of this stuff off to the side, but it is creating like more adhesions and more problems that take a little bit longer to get rid of. A lot of times it's bad biomechanics. So that's why I do a presentation like this, because you can release that stuff out, but the bad biomechanics stay there. It's going to keep coming back. So, but this is a good way to kind of release something out, especially if you have an event coming up. So now we'll get into a little bit harder stuff. So for that part of the quad, the same as the hamstring, we need to have weight onto it, and then we have to stretch everything out. So how we do that is we lay face down. Let me know if you can see this on there. So I'm going to put it right on the edge of my quad. Oh, I was talking about the injury. So this will be stuff like when you have knee on the front of your, you have pain on the front of your knee at the bottom. So patellar tendonitis. Yeah, so this is where you're going to want to release out on it. So if I just lay down like this and I have the weight of my leg on there, not enough. So now I'm going to lean onto this leg, and then I'm going to bring it up this way. And if I'm not getting enough pressure, that's where you can get the towel again or one of these stretch bands, put it on your foot, and then you just pull it this way so that you can get that through there. And so you go all the way across the knee. So it'll probably be like 4 or 5 different spots that you want to get in on there. And so just keeping the pressure through there.
And you'll know the spots when you hit them.
Like that.
Yeah. So
It's not like it'll be sneaky. They'll find you. But when you have patella tendonitis, when you have that pain under the kneecap that's in the fleshy part, that's a quadricep problem. It's not necessarily a knee problem. So keep in mind, it's a lot of times it's that one domino away. This gets tight, knee hurts, so you work on
Well, that's whenever someone sends me a note, says, "Oh, my knee hurts," and I made an appointment with an orthopedic. I'm like, no, hold off with that first.
That's like step 8.
Yeah.
We got to go to the first 7.
yeah, that's a lot of times that patellar tendonitis is just because the quad is too dominant. The quad's going to be stronger than the hamstring all the time, but it can't get too dominant because then it's going to pull too much, and it's going to cause a lot of issues in here and it cause a lot of inflammation. So all this pain that I'm talking about is inflammation. And if inflammation builds up, then you get pain with it. And then basically if we look at the quad here, this is called the VMO, then you have the rectus femoris, and then you have the lateralis out here. All through here is all quadriceps tendon, and then this is patellar tendon. We don't really mess with that too much. That's what I do in the clinic if it gets bad enough. Most of the time we're just releasing this out, so because this is the tight muscle that's pulling on it, and you get a lot of adhesions in there. So if I get the ball somewhere in there, and then I'm straightening it out, ball's sitting on the quadriceps tendon in between where the muscle's at, and then I'm stretching up through it, and stretching up through it, and just working my way across the knee. But the other thing that you probably aren't noticing, I didn't say anything about it yet, is I'm always between where the muscle is and the tendon starts. And where you know that's at is just like any muscle. I mean, if you have that there, that's where the tendon starts. The muscle belly is the stuff that will flex and you can see. through there. So if you flex the leg, you can see muscle here, muscle there, tendons all through this area. And so I'm just going across.
Will the PowerPoint make that a little bit more easy
Yeah,
to
I'll put
identify?
actual anatomy slides on there, and that'll
Okay.
have it. Like all the muscle belly is going to be red, the tendon and all that's going to be white, or white or grayish. Yeah, so all that will be in there. And I'll end up making another video. We have this video here, but I'll make a video with someone actually on the ball, and I'll be showing like the stretching and everything like that. So this was just to kind of give you the idea of what we're doing, because there's going to be spots I didn't go over, but if you keep like everything I'm talking about in mind, then you're able to figure it out on your own. You just put it in there and be like, all right, I got to go short muscle to long muscle, and I got to put the ball on the muscle. So that's what we're looking for. Now we're going to do upper quad and hip flexor. So I can still show myself on that one. So upper quad up in here.
I'm ready though, Coach.
Yeah. Upper quad in here, hip flexor goes right to the inside. If you touch the hip bone that points out on the front, right to the inside of that is going to be where your hip flexor rolls through. And then upper quad, if you do this, it's going to be the muscle part that you feel contract right in here. So it's like quad and TFL. But the quad attaches in right on the bottom of that bony part that you feel in your hip, and then the hip flexor is right to the inside of it. So what we're going to do is we're going to stick the ball there, we're going to be laying on it, and I'm going to take my leg and extend it this way.
Now, will that work better with a smaller ball, or will it work better
Yeah,
with a bigger ball?
yeah, it still works
Smaller
better.
ball?
If you're not getting enough pressure with a small ball because it's just too little, that's when you shift over to one of those. With one of those, you're not going to lean as much onto it. So I'll show with both. So if I go in here, I'm going to lay on it and get it in the spot. So I'm right to the inside of that hip bone, and I'm going to bend my leg. Now I'm leaning onto it. And this one I have to kind of push down, because as I come up, my tissue's coming off of the ball, so I have to make sure the ball goes into what's still laying on the ground. This was a lot easier on
That's
the tile
hard
floor.
to do. Yep.
You would rather not volunteer.
Glad I didn't have to volunteer for that.
Yeah, so you're going to want to use the big ball for this one. So pressure's on there, and now I'm just going to go straight up through there, shifting my weight down as I go up. So if you do this pretty slow, it's pretty easy. You just follow the ball along there. Get that timing. That release of that, now I can shift it over, put it right on the quad, and now what I'll do with this one is I'll bend the knee and take that out. But if you bend the knee, you're stretching out the quadricep. And you just want to go up a little bit. That's probably one of the more complex movements, because you have to bend the knee and come up. About 10 to 15 passes, or until you get tired. I'm already starting to breathe heavy. Really, you'll start to feel it loosen up. It feels like a really deep tissue massage. And then if you're having pain there and you put this ball on there, it really hurts. Like it'll light up pretty good. And then, but as you start to do it, you'll notice that it's not hurting as much.
Can I add something?
Yeah.
One thing, there's not a lot of people get injuries in here that stop them from running. They just get tight, which means your stride length changes, which means your form changes. So if this gets tight and you ignore it, other things break because your biomechanics change. So just because you don't feel a lot of intense pain, it's just really tight and mildly uncomfortable, you still need to pay attention to it, because that's that first domino. The next domino is you're limping around because one leg's getting longer extension than the other. So pay attention to places that get really tight, even if it's just mild discomfort, because that becomes other stuff. Stress fractures are because you're doing something else.
Yeah,
It makes you move
adjust. You adjust.
Your
Like,
body
if
keeps
you're
adjusting.
If you're tight, then
Yeah.
you run differently, and then that running differently.
And that's putting
causes-
pressure on maybe weaker spots that aren't your strengths. And then, so just pay attention to that stuff. Just don't let it go, because something else will go wrong.
Yeah, so one of the things I was going to get to towards the, when I was going to talk about this last spot, this all happens because, like Dave said, most of the time what I'm seeing is hip drop. So when you guys are running, whenever you pick one leg up, this hip stabilizer should contract so that this doesn't drop down. But what happens is as you go through the run, that gets more and more tired, so you start hip dropping. Do you see how my leg comes in wrong?
That's
So
why
if
we
I'm
fall
standing
so
here
much.
and I drop, well, see what?
So that's why we fall so much.
Yeah. So
It is.
we go here, and if I drop that hip,
Yeah.
you can see what happens is I drop down, my knee comes in, and my foot pronates. So that foot pronation is going to give you a lot of problems on this posterior tibialis, and then that's where you get the stress fractures, like he said. Plantar fasciitis comes from that. the calf problems that I talked about, all of that will come from that hip drop for the most, for the most part. Hip flexor is going to get worked all the time. So in cyclists, we have to worry about it because we're always doing this and we never straighten all the way out. We're always stuck on the bike doing this every time. At least you guys get to have that kickback that stretches the hip flexor a little bit. But you still need to pay attention to things like this. And that's where this one is important because the foam roller doesn't get in there very good. Foam roller will do the quad pretty good right up to the hip bone. But if you want to go into that hip flexor, you can't really get it.
And if you're going to travel, this does you a whole lot more good than trying to put a foam roller in here.
Yeah, it's a big 36-inch one.
You can do a lot of stuff with this.
Yeah, so now we get to the one that started all of it. So now we'll have you stand up.
I'm ready, coach.
Hip stabilizer, face that way. This is almost a triangular.
Can you do it the other way around?
Triangular muscle. So it's starting over here in this ridge, and it's coming out to the side here, and it just basically follows this area here. And when you stand on one leg, that's the one that contracts so that you don't fall over. So the one that's working is on this side when he does that, and now it's this one.
Something's broken.
And it's actually one of the tests I do. You stand on one foot, and if you can't stand here without wiggling around, that means it's weak, it's tired. Yeah, and so I can do it right now, but if I started doing a bunch of core workouts and stuff, I would start wiggling around a little bit. So you can fatigue it, and then it gets tired, and you guys are doing long distance stuff, so it's going to get tired. And even the exercises that I give you, or you can even find, I know y'all are doing some running exercises already. So those things, it's hard to mimic that. It's kind of like my patients that come in with back problems. They sit at a computer all day long at work. I can give them postural exercises, but they'll still only last a certain amount of time because then they start going down, and then they have all the issues that bring them into the clinic. So here we go. You'll have to use one of these.
Is that the big one?
Yeah,
that's the big
ball.
spiky one.
Yeah, so they can get in there. So remember, it's in this area. One of the landmarks you're going to want to know is the greater trochanter or the femur. So if you just do this on the side of your leg, it's the bone that you feel right there. And so whenever you do this, we're going to rotate it this way. It disappears here and it goes back here. And so when you feel that, you're going to be able to trap the ball right against that bone. That's where the muscle is. Now we're going to take it, stretch it out, and stretch it away. So the reason why we're stretching it out is we're getting the weight onto it, and that's kind of putting the ball in better position. And then when we do this, that's lengthening the muscle because the muscle is going.
And you do this using
like
weight
this.
On the ground?
Yeah. So I'm going to get
Body
down.
weight.
Y'all won't be able to see it, so I'm kind of taking it through. So if I'm here, I'm going to rotate out. I'm going to go into the ball and then stretch it away. And then I'm going to come back with my leg straight, come in and stretch it away. And come in, stretch it away. And the reason I came up with this is because it bothers me all the time. And I can't work on myself like I work on my patients, so I had to do this. So I usually lay down. Now I'm onto the ball. I have my leg. You can see my knees rotated. And I'm going to come up into it and stretch it away. Go down, roll it back to the outside, come up into it, and stretch it.
What is this
around.
hitting again?
This is hitting piriformis and
Okay.
glute medius. And then I'm going to keep going. And you'll know, like you can go all the way through it. You'll know if you're not in the right spot because you'll basically be hitting bone and it's not going to feel good at all.
As opposed to when it feels less good.
Yeah.
When it's on the muscle.
Yeah.
Like that's not good.
It hurts on the muscle, but it
Bone
feels
good and muscle good.
like a really deep massage. And so that's pretty much it. So the key to all of it is you're starting with a short muscle, lengthening it through the pressure of the ball, and you just got to know the anatomy. So for you guys, it's going to be glute medius, hamstrings. Remember that the hamstrings attach into the sit bone, so it attaches all the way up here, goes down to here. This is about where the muscle belly stops, and then tendons go on each side of the knee. Calf or gastroc is going to go there, lateral head, medial head. Quads, the quadriceps tendons, the end of the quad's there, and then top of the quad, and then right to the inside of the bone is the hip flexor. And
You said, everything you said was nothing on the muscle. You called the muscle belly. It's all where the tendon.
you'll hit the muscle belly, but a lot of your pressure is going to go right where the tendon's at, because that's where you're going to get most of the stretch. Yeah, and so that's not as important. You'll kind of get onto it, and you'll kind of know, because I want you to hit the spot that hurts. Yeah, and then if you're just doing this to get a good stretch, I wouldn't do it 10 to 15 times. Just kind of go through there, do a few passes, and that's enough. Yeah, because it'll leave you kind of sore. I mean, my calf muscle is still a little sore, and that was the first one that I did. If you're hurting, yes. If you're not hurting, no. Because it'll. I mean, if I were to run right now, I would feel that every time I pushed off on my calf. The rest of my leg feels fine, but the calf is hard because it's such a small area. It gets really deep into it. It's the same as a foam roller. If you've ever done the foam roller right on the calf muscle and you cross the leg over, you feel that one the most, except for the IT band. And I wouldn't use this on the IT band. That's murder. Yeah, it's not good.
So if you're struggling with something, I mean, you also don't want to do a whole lot of work on something that's too cold. So it's always, if you're going to do that, it's a good idea to walk for 5, 8, 10 minutes first, then do this, then do the run. We did that if we were injured in college. We'd do a real light warm-up, then do the release, then run. And it seemed to help. But I can't do things cold. That just seems that seems to be unfriendly.
Yeah, even in my case, like when the patients come in, they've usually been walking around all day, or even when they come in the morning, they got to get up, walk around, and get into the office. And so
y'all launch out of your front doors 4 o'clock in the morning.
No, we sit in the car and then it's like, when it's time to go. Then we start like, yeah.
That's why cold showers are good, because you start shaking your muscles. Right? I've heard cold showers are good just before you run, just to warm your muscles up. Yeah.
It's already bad enough you're running in this stuff.
And if y'all, these are amazing in the car to sit on.
Yeah.
Get them in the right. I mean, I know people are thinking weird things as they drive by you because you're like, oh yeah. These are when I used to travel for a living, because you can even do hamstring in the car too. It's awesome.
That was one thing I didn't show. So let me show you what most everybody's doing now. So you're getting on it, and then you're just rolling around on it, right? And so all you're doing, do you see the difference? The muscle's not moving. So all you're doing is rolling through the fascial tissue, and you are releasing it some, but that's different than if I have the muscle short, and then I'm taking that pressure through there. So when you come into my office, I can get Dave to lay down. I'll show how this is similar
What do
to
you
what
want
I'm
me to
doing.
do? Per se?
Just put your feet down that way. I'll stand over here. So maybe
You say, I'm ready.
here, then we can scare people.
Are you doing Graston? Oh no.
Yeah. No,
It's
Graston's
not
easy.
called Graston.
What is it, Graston Hicks?
It's called something not Graston.
I'm Graston certified. I just don't use their tools, so I can't say I do Graston technique.
Okay.
Graston-like products.
It's IAST. Instrument assisted soft tissue mobilization.
Okay.
So, same thing here. The ball's taking the place of my finger. If I'm working on his hamstring, I'm going to find a spot. He's going to tell me that's where it is. So I'm going to get on it. And I'm taking a short muscle. I'm holding pressure on it. Taking a short muscle. And just stretching it out. And so my stuff is a lot more specific. But like I said, it's good in a pinch until you can get in to see me. Or if it's pretty mild, this will help release it out. You can get through your event. But it is something that you still want to take care of, because it usually means something's wrong with the biomechanics and it'll keep coming back. So overall, you have to do some sort of exercises, and it's best if someone assesses what's wrong with you, because if not, then you're just doing general exercises. And you can, if you compensate, that's where the imbalance came from, is a lot of compensation. So if you have that, you're not going to really get better, and over time it's going to get dysfunctional again. It'll just keep coming back. It might take longer after I release it out, but it's going to come back eventually if you keep running the same amount.
So when I went in, when I had my my foot and ankle problem, I went in. Dr. Ramirez did a gait analysis on the treadmill and had me do a bunch of exercises to test my core strength and a bunch of different things, and it was pretty neat, because I didn't realize how pathetic of an athlete I was until I couldn't do this little simple exercise. So that was great.
Yeah,
Love that.
There'll probably be another day that I come and talk about like the exercises and stuff. One of the things to keep in mind is, like, they talk about using equipment or using bands, but if you're failing without it, then there's no reason to start with it. Like, that's a foundation. If you can't do the foundational stuff, there's no reason to do all the other stuff. But what I try to do is, because I know athletes are in the middle of a season, or they're trying to do something specific, and they're either working with a coach or they're working with some sort of program. I try to keep it to where you don't have to stop doing that program. You can just start doing the foundation stuff that I give you, and over time it's going to catch up, and then your injuries will I can't say they're going to not come back, but they have a lot less chance of coming back on there. So we're pretty much done with that. I was just showing what the actual treatment is, but you can see how that mimics the same thing, so that's why I kind of did it. So the hard part is No, you're good. I have a lot of anatomy training, so I know exactly where all the anatomy is. So in my head, it's easy. I come up to it, I can do it. If I was on the ball, same thing. I know where the anatomy's at. I can just start working on it. So for you guys, if you start looking at pictures, I'll get that PowerPoint put together, and then you'll be able to look at the anatomy that is relevant for the lower extremities. And you can kind of do your own thing. I mean, kind of like how he said stress fractures. If that posterior tibialis starts bugging you, then you can look at a thing and say, oh, he called it posterior tibialis. Or you can look at stress fractures, what muscles they are. You'll see somewhere they'll name it and say, well, where is it at? And you'll find that it's here. And so you can get on it, and you'll know that it moves that way. You just need to know the function of the muscle or which way it moves. And then you're moving up, you're opening it up. You're basically stretching it. So like if I were to do my bicep, so I said we start short and go long. So that's long bicep, that's short bicep. So I put the pressure there, and then I'd stretch it out long. And then I would just go across the whole muscle and then just strip all that out.
I have a question about biomechanics. In terms of the services that you offer, are you able to identify whether the biomechanics issues are either musculature or with, I guess, since you're a chiropractor, since if it's with your, like how your bones are structured, I don't know, like your hips or, because I mean, like naturally, like I have like one side of my leg is actually quite longer than the other, and you know I have a lot of muscle tightness in the other side that just sort of accentuates it or tries to compensate.
Scoliosis.
Kinda, it's not like really bad, but it's So I mean, so are you able to identify whether?
Very rarely do you have a congenital leg discrepancy. So like some people just have a longer femur on one side than the other. They need heel like lifts in their shoe.
And I have, so I have.
But it's not very common. The most common thing is the muscles cause imbalance or the joints get restricted.
Okay.
And so that's actually like it'd be funny if my old professors knew you were asking me that. I used to argue with them because there's people called straight chiropractors, and all they do is adjust all the time. And in their mind, or what they say is, if we adjust all the time, it fixes everything. Like it's just gonna, like you're starting from the foundation and you're adjusting it out. There's no restrictions on it. The nerves work better, so that means all the organs work better.
But then you have to go to the chiropractor twice a week until you die.
Yeah. So like you're just doing a lot more adjustments. And so I used to argue with them. I said, well, what about the muscles? And they say, well, if you adjust them enough, it loosens up the pressure on the muscles, and then they don't have the problem. And I said, no, that's not right. You have to work on both.
Yeah.
Like you can't just work on muscles and expect the joints to release.
Yes.
And you can't just work on joints and expect the muscles to just be okay.
Exactly.
But a lot of times, all of us have a failure in form in whatever we're doing. So for my CrossFitters, they start lifting stuff and they get a little bit too heavy and they lose their form, and then they wonder why they get hurt. And then they wonder why everybody says CrossFit's bad. CrossFit's not bad. It's just everybody wants the PR. Yeah, it's just everybody wants the PR, and it's the same as if you guys went and you're up to like the 10-mile mark on your training. You're not ready for 20 miles. But then it's like all of a sudden you go do 20, you're losing your form between 12 and 20 miles. And so all that whole time you're doing that, you're starting to put a lot of pressure on different areas. Your body's really good at compensating for that and fixing it, but if you keep doing it, it's going to catch up eventually. So kind of going back to like the original question on it, it's pretty easy to see. You just have to know what the function of the muscles are and all that, and then as soon as I get you through certain exercises and movements, I'm able to see those differences.
Okay.
But a true discrepancy is figured out on X-ray. So if we shot X-ray and it was like your either whole body or from lumbar down, and then you can actually measure the bones.
Yeah.
And then if it's like that, then that's a true discrepancy, and that needs lift because you can't change the bone anymore. It's already grown.
Exactly.
Yeah. So and then if you have scoliosis, that causes a rotation and a twist, and so that's going to make one side higher than the other. And until you fix that curve, it's not going to change. And you can't fix a curve once you're an adult, and it's really hard to fix even in children.
But you do offer. I mean, is that something that you do offer, like as part of the complete?
Yeah, right now what I'm doing is if you come in with an injury, I have to get that movement right. So if you come in and you're having an issue in your hamstring, and you're having a lot of pain there, if I did the functional assessment right when we started, you're compensating for that pain in there. So then my results are going to come out skewed because it's going to look like you have all these other issues, but it's because you're compensating for the pain. Okay. So when I get everything moving the way we need it to, and it usually takes about 2 weeks,
okay.
When I get everything moving the way we need it to, and then the pain starts to go out, then I'm able to do the assessment, and then that's when we see different problems.
Okay.
Yeah.
All right.
And then for you guys, I'm using the treadmill because that's what y'all do, y'all run. And so like for my CrossFitters and them, I have them doing squats and different things like that. One thing that's universal for everyone is I'm testing your core. So I'll make you do like 5 exercises on the floor, and I'm just looking at how the core interacts with your movements.
Okay.
Yeah, and nobody's core is weak. So like everybody says, oh, core is weak. It's just there's huge imbalances in it, and a lot of times it's not activating when it should, because we're not used to making it activate when we're doing movements. Like me just standing here, I should have my core activated. Me moving my legs, you just get used to doing that, and then you're able. It takes a lot of pressure off the spine, and then it fixes a lot of other issues that you might have.
Okay.
We're pretty much to the question part. It gets a lot better if people ask me lots of questions, because I leave out a lot of stuff. But I need to know specific stuff. Anybody had injuries? Anybody wants me to talk about certain injuries?
All right, I have it right here.
Yep.
Is that what you were talking about?
Yep, that last one, the most important one.
Right. So I feel like a pain. You know, I can run with it.
Mhm.
It kind of comes and goes. It's not like a constant thing.
Mhm.
So every now and then, and I think it's, you know, I'm a programmer, so I sit on my butt all day.
Mhm.
So I think I put a lot of pressure on that.
Do you sit in
Right,
your wallet all the time?
No, I don't sit on my
Okay,
butt.
good.
No.
Yeah.
I work from home, so it's in shorts.
Okay, good. Yeah. So one of the things you'll do is that all day stuff, like the people's jobs or anything that you do all day, like that's actually causing the most problems. But then when you start doing whatever activity it is you like to do, it's going to set you over the edge. Like there's already inflammation from whatever you're doing all day, your postural problem. And so like sitting in the chair is causing some irritation here because of either the hips being off balance, or you're sitting a little funny, or the muscle being short all day long, it gets irritated. So then when you start running, it's already kind of irritated, and then you have like a little imbalance there or a weakness, and then it starts building up a lot faster. But yeah, doing that or stretching it is the best thing. I have that issue too, so I have a lot of piriformis problems, and mine still comes back every now and then. If I do really hard intervals on my bike or something like that, the next day I might have like a little like a problem in there, and then this is what helps me, because like I said, I can't treat myself, and so I was doing foam rolling stuff, but that would help a little bit. But at night what I would do is I'd get my fist and I'd put it in there and I'd start doing that thing. So then whenever I got these in, when I ordered a set, I was like, hey, wait a minute, that could take place of my fist. And so but yeah, so you want to release all that area, and then you're saying it's traveling down, so
it does travel. It's not like they call that nerve.
Sciatic.
it's nerve, it's sciatic, yeah.
That you're pinching?
Yeah, that's it, yeah. So there's two
Pressure
places
on
you
it,
can
yeah.
pinch it or put pressure on it, and it's at the nerve root, which is in the spine. So you could have a herniation, or you could have a lot of degeneration in the spine, and it's causing some issues. And then the muscle being on top of an aggravated nerve is just making it worse.
Okay.
Or it could be the muscle by itself. And the crazy thing about piriformis is the sciatic nerve is like that thick, and it just runs down the back of the leg. The piriformis lays over it like this. So if you're lucky, there's 3 different ways. So the luckiest, they have it behind the sciatic. So when the piriformis gets real tight, it doesn't cause a whole lot of problems. Then some people have it over the top, so when it gets tight, it goes here. But there's a third way, and it bisects it. So when it gets tight, it pinches on it. And those are the people that when they have piriformis problems, they always have sciatic issues. And so you have to get that to release out. It's an external rotator, but all it does is supposed to keep your foot from coming in. So if you're running like this, and this is what I see a lot on the treadmill, I think Dave had it, yeah. So when y'all are running, you're coming up, and you're probably too narrow at the knees, and so to get your foot to come straight, you just do this. And so every time you do that, you're contracting the muscle that's not supposed to be contracting. And then you're contracting it with load, because it's coming here and it's getting ready to fire off to get you forward the next time. So the glute's getting ready to fire off. It gets tight all around it, but that piriformis keeps contracting when you do this, when you bring that foot forward. So that's where we have to fix the biomechanics, because every time you go out and you run like this, you're causing a lot of irritation to it, and it's just always going to get tight.
And a lot of people think that they have hamstring problems or even shin problems because they're getting that radiating pain down, but the minute you release the pressure from the piriformis and you open that up, a lot of times, oh, wow, that's weird, my shin doesn't hurt anymore. So it's all connected. That's why I go see him, and he makes me, I really laugh like that the whole time he works on me too.
Yeah, it's the largest nerve in the body, and it has branches that go. It basically comes out of the low back, combines with the nerves of the sacrum, creates that water hose size nerve bundle, and then it just has branches that come off of it all the way down to the toes. And so you'll feel it all the way down, and it gets really irritated with that. Piriformis is a small muscle, and it caused me like 2 years of pain.
So
It's
does
one of the
everybody
reasons
know-
I'm here.
Does
So.
everybody know what it is? Runs from the tailbone to the hip bone, right?
Yes, it goes on so my sacrum, the sacrum is that upside down triangle at the bottom of your spine. So it's facing y'all through here. And so on the inside edge of it, the piriformis comes out and it goes to that greater trochanter out here. So it's just going straight across here. And we usually release it at that greater trochanter because I can get it pushed up against against the bone. I can really strip it out there. And you can't really get to the anterior side of the sacrum whenever you're trying to work from the back. So you just stretch that out and then you release it out at the ends. Any other questions?
I know you talked about the tendonitis in the bottom, top of the knee.
Same thing.
Oh, you feel it more in the top of the knee?
That's exactly where I feel it right here.
Yeah, so that's actually
After
easier to
doing
get rid
lunges.
of. Yeah, so
So I don't do lunges.
Right.
Yeah.
This on this knee, top of the other knee.
yeah, so if you usually what it is if you've been a runner for a long time or you did gymnastics or softball when you were younger, none of that. No. So
Just
what happens
lunges.
is those things
It's
cause a lot
actually just
of
lunges. It's when I do lunges.
Well, you
So-
have degeneration. So as we get older, we start having degeneration. It
Yeah,
creeps
I'm
in
old.
everywhere, and so yeah.
Okay,
And
so go to the part that's easy to fix.
Yeah.
No.
Well, you can release it out. The problem is you have to support the joint more, so that it won't get so irritated. But yeah, if it's just lunges that are causing it, just modify them a little bit.
Do
and
quarter
then-
lunges instead of full.
Yeah,
I do
start.
front squats, and so there's really it's just. I mean, it
Yeah,
does
just
hurt all the
release it
time.
out, yeah.
And
I have a lot of luck with mine, not only releasing it here, but actually working the big muscle with foam rolling. If I
Rolling, yeah.
foam roll, it stops hurting there.
Okay.
So,
And you can, if you have enough pressure with your thumbs, most of y'all won't. That's why I show you with the ball, because you use your body weight. But if you have enough pressure in your thumbs and you're crazy enough, you can just mash in on it, and then you can just bend your leg, and you're doing the same release. But you just have to really push in, like good pressure. Most people's hands, I mean, it was probably almost a year before I got my hands strong enough where people that had gotten the treatment before weren't complaining. So when I first started, they're like, oh, he doesn't push hard enough. And so it took a long time. And now,
driving to work with a little squeezy thing in the car. Oh yeah. Strong hand.
And this is just, like she said Graston's the most well-known. They didn't really start it because it's actually like Korean and Chinese medicine that started this stuff with antler and jade. And so Graston just kind of put their spin to it. They made it stainless steel. As you go through, you can feel the vibrations on it, and that tells me where the adhesions are. And then go through. This one's hollow, so you don't get as much of those vibrations on it. But you kind of know where it's at. And like I said, I use this for the superficial stuff. So if you're not getting good range of motion, let's say it gets really tight here, but you should be able to go all the way out here. I'd get in here and I would do this. I would do the release here first to get the deep stuff, and then I'd go in here and just scrape this all the way around, and then that would really free it up. You feel a big difference when I use this for range of motion. It's just a lot easier to move.
You don't use it to break up any like knots or anything like that.
I mean, sometimes I get into them, but everybody knows, like when they come to my clinic, that my thumbs are the ones to be
The
afraid
thumb of death.
Yeah. So like they're always like, oh, you're gonna use that thing? I'm like, this is easy compared to the thumb. Yeah, this is super easy. When I start doing this, everybody's like, oh, that's pleasant. And so, but other people that go to
Pleasant.
yeah, other people that go to
I
their
know.
offices, yeah, see,
That
Yeah.
doesn't hurt. Yeah.
That doesn't hurt.
Well, I know
No.
when I did my ankle. I
Well-
used a little one on my ankle. That shit hurt.
yeah. And then the bottom of the foot, it's rough because I have.
Oh, no wonder. I
get
get
it
the
and
two
I
spots that
scoop.
hurt, of course.
Yeah, because I basically get it and I scoop through that fascial tissue and just break it up.
So I went from barely being able to walk to working. I think I came about 6-8 weeks, and then started doing exercises, and it was incredible.
Night and day.
I mean, it wasn't gone. I still had a problem, but I was limping around in the store listening to everybody make jokes about, can't you afford good shoes? It went from that to at least I could function and, run a few times a week, and now I'm almost 100%. But it definitely got me from completely crippled to being able to function. And, then it had to heal up on its own. I had to do the exercises, but there was an immediate improvement.
Demonstrations?
How often we need to do this one? After the run or
Yeah, if you're having pain, I'd probably do it.
only the time we have pain or that's all?
Well, there's two different. If it's just tight, you can do it every day, and you can do it like once or twice a day. If you're just kind of releasing out some tightness, because you're not going to do it as long. You'll do a few passes and then you're good. But if you're having pain, I'd probably do it maybe every other day, and then after like the third or fourth time you do it, if the pain's still there, then you got to get it checked. But other than that, like you can probably do it for about a week and just go through there every other day, release it out, and then see if it makes a difference. Then you have two choices. You can go see someone for it, like you can come see me, and then I can check it, maybe do a deeper release on it, or stop for a little bit, like take a week or two off of rest and release it out.
Oh my gosh. God forbid.
But that,
Try training. Swimming. There's swimming.
Oh.
Is it harmful to roll every day or?
mm-mm. No, I tell people like rolling is a lot better than static stretching.
Pain or?
So like this whole thing, stretching your hamstrings, it'd be better if you just rolled on it for 2 minutes.
Yeah, so there's a lot of world-class runners that don't do static stretching at all. They don't. Now, their difference is they usually have full-time masseuses that are working on them every day. We don't have that, so the foam rolling can plug into that roll for us. But yeah, I mean, if your choice is to static stretch or to foam roll, you foam roll every time. From what I've been told, sorry.
Yeah. No. It's I don't like
From
static
what he
stretching.
told me, yeah, my bad. What he said.
And then like the generation before most of us, I used to tell people to stretch. I don't know why they do this bouncing thing. I don't know when they ever taught people to bounce stretch, but that's not good. Yeah, you're coiling and recoiling all the fibers of it. Yeah.
Back in the 80s.
Do that on a
For you
cold.
young guys, you don't remember that.
Yeah, do that on a cold hamstring, and one day you're gonna hear a snap.
You don't strain on cold muscles. You should warm your muscles
Can you,
up
is
before you stretch
rolling
them.
cold okay?
Yeah, it's actually a good warm up.
Oh, okay.
A lot of CrossFit people do that as part of their warm up.
What is that?
So
The foam rolling.
Cold, when your muscles are cold.
can you be a little bit louder
Foam
for
roll when your muscles are
For
cold.
the back or for the camera?
the camera for
The
the
whole
people
thing?
so that they can hear it? So what do you do with what is it?
I thought you meant the whole presentation.
No.
Like, here we go again.
No, that it's okay to foam roll on cold muscles
Yeah.
That's-
So, I mean,
that's-
foam rolling can be used as a warm up tool too.
for cold muscles. Okay.
Yeah, and that's why I like it better than static stretching. One, you're getting more pressure into it, so you're getting into the myofascial tissue, and you're not just stretching out the fibers of the muscle. You're actually releasing that out. And foam rolling is always done like out here, so the muscle's already stretched, and then you're just going through it and rolling it out, and breaking up some of those adhesions.
So before your runs, foam
Yeah,
rolls.
everybody foam rolls in here.
Get up 15 minutes
There's lots
Yeah.
in here.
Sleep on it. Close your eyes and
Just don't go so fast.
yeah. I can do that too.
You did the demonstration, so you get. And he can give it away. You get the Uniball. 'Cause that one
So
doesn't
what
have a
do
partner.
these retail for? No, give us somebody else.
Who wants a Uniball? Well, that's hard. 'cause
Okay,
then
that was a
everybody-
horrible way of
Yeah,
doing
yeah. As I said it, I was like, that didn't work.
it.
It's not like when I have the elementary kids.
Quiz, do a quiz. See if
Quiz.
somebody can pick what muscle you talked about and name the muscle or something like that.
You can just do a drawing. Oh, I didn't bring my tickets.
I wonder if I'm paying attention. I know who y'all ran last night. Didn't sleep.
I know.
So
I have one.
Let's
Go ahead,
see.
ask me.
But then if a lot of people know the answer, then that doesn't work either.
You came in late. You can't win. Unless you brought tacos. Oh!
Wait.
That's why I was late.
Who got? I didn't get my taco this morning. Somebody was supposed to bring me
Taco this
tacos.
morning?
Yeah, somebody said they were bringing them.
I can believe that. I love.
So I think there was 4 people that said it. All right, we'll go number 1 through 20.
I was gonna say, write a number down on a piece of paper.
Are we done?
Yeah.
with the important stuff.
Okay.
Yeah, that's.